Assalamu alaikum dear doctor. In this video I am sharing information about how to prepare for cardiovascular short cases. So cardiologist station is the station that you should try to score a clear pass. Often the spectrum of disease likely to come out in the exam is predictable and you should try to see all these patients while you are preparing for the exam. The following tips will help you in your cardiologist station preparation. Number one tips is that if you are using a normal stethoscope, we suggest you that buy a cardiologist stethoscope and use it at least 6 months before your exam. The college allows candidates to bring their own stethoscope. If you use a poor quality stethoscope, you are at risk of missing important signs on auscultation. More importantly, you should try to listen and appreciate as many murmurs as possible in preparation for the clinicals. Number two tips is that when you approach a child with a cardiac problem, it is very important to first decide if this child falls into the acyanotic or cyanotic group. Mild cyanosis may be missed. Therefore, look hard for clubbing, both fingers and toes. 3 tips. Next, you need to assess whether this patient has any signs of respiratory distress. This helps to narrow down the differential diagnoses. Respiratory distress indicates that there is increased pulmonary blood flow with pulmonary congestion, which can be seen in patients with significant left to right shunt, mixing of systemic and pulmonary blood flow, therefore increased blood flow to the lungs and left ventricular failure. The list of differential diagnoses for a child who is pink, not breathless, pink and breathless, cyanosed, not breathless, and cyanosed and breathless are different. Number 4 tips is that the surgical scars often give valuable information on the possible underlying cardiac lesion. Look carefully for the surgical scars. You may miss it in patients with fair skin. Remember, most of the cases up in the exam would be stable patients who have undergone cardiac surgery. Be familiar with postoperative cases. 5 tips is that besides cardiac murmur, the second heart sound is equally important in helping you to establish the diagnosis. A soft S2 indicates pulmonary valve stenosis or atresia. A loud S2 indicates pulmonary hypertension. Fixed splitting S2 with soft ejection systolic murmur suggests atrial septal defect until proven otherwise. Learn how to appreciate a soft, normal or loud S2. Number 6 tips is that if the patient is dysmorphic and you can diagnose the dysmorphism, look hard for commonly associated congenital heart disease. Example, Marfan syndrome, the cardiac lesion is aortic regurgitation, mitral valve prolapse. Turner syndrome associated with coarctation of aorta. Noonan syndrome, we find pulmonary stenosis. And Down syndrome, we find atrioventricular septal defect, AVSD. Williams syndrome, we find supravalvular aortic stenosis. However, do not create signs or be preoccupied with the associated cardiac lesions and try to fit in signs to suit your diagnosis. Present what you find. Number 7 tips is that the oral presentation for cardiac cases is standard as we follow the steps and sequences in cardiovascular examination. Therefore, it is good to have your own script for the presentation and practice it again and again. This helps you to present smoothly even when you are under stress. Number 8. Be ready for discussion. Investigation comprises of chest X-ray, echocardiogram and echocardiography. Make sure you know the expected findings for the above investigations. Elaborate on your answer before the examiner asks you. Be familiar with the principles of management of pediatric cardiac diseases. This chapter highlights the points illustrated above. A list of cardiac diseases likely to be seen in the clinical exam is also attached. Last but not least, examine as many patients with cardiac diseases as you can. Take the initiative to go to cardiac clinic and IJN. Learn from the patients. Now the list of cardiovascular short cases we need to know. 1 VSD, 2 ASD, number 3 PDA, number 4 pulmonary stenosis, number 5 aortic stenosis, 6 innocent murmur, 7 dextrocardia, 8 is coarctation of aorta with lateral thoracotomy, scar and radiofemoral delay. 9 number is TOF, tetralogy of Fallot with post-Blalock Toshing shunt and corrective surgery plus minus pulmonary regurgitation. Number 10, complex cyanotic heart disease. Example, pulmonary atresia, intact ventricular septum, pulmonary PAVSD, DORV, single ventricle and with PA, tricapsid atresia with Blalock Toshing shunt or palliative surgery done. Number 11, Essen-Menger syndrome. Very rarely come. Number 12, rhythms, bradycardia and irregular. Number 13, absent pulses, that is tachysus. 14 AV fistulas, and 15 AV malformations in failure. So this is all about how to prepare cardiac stations short cases.